here present with President Massimo Scaccabarozzi. I'd like to thank all the speakers, and also in particular Robin Linkins from the CDC of Atlanta and Bruce Jellin from the HHS, Health and Human Services of the United States, who took their time to fly over for this conference. Thank you. And finally, the Giovanni Lorenzini Foundation for their work in helping to set up this conference and their scientific support. As we well know, the key objective of this conference is bring together high-level representatives of key public-private stakeholders to discuss the state of health of vaccinations in Europe today, and jointly define a vision for future actions and directions to normalize prevention in societal and health care practice, securing thus the role of vaccination as a part of it. There is no doubt that the Ebola crisis highlights the crossover impact of communicable diseases and need for global and equitable solutions. And there is a need for continuous and inclusive dialogue to address common misconceptions, apprehensions, and also, as we know, suspicions. When we talk about immunization, often we mean vaccinations, but not only human, but also animal. Because animals' disease may have a strong impact upon human health. And that's why we have also a presentation this morning about animal vaccination. But we also mean cancer vaccines, both as primary preventive measures. Think, for instance, of hepatitis B, which was, as a matter of fact, the first preventable vaccine for cancer, but also the HPV vaccination, which today also has a universal meaning. And as a therapeutic tool, too. Today, there is only one therapeutic cancer vaccine which has been approved by FDA, but the area is really crowded. The concept of immunization is a cultural one and must be understood not only by caregivers and not only by all of us, but also by the civil world, by politicians, by the citizens. In Italy, we have a long-time scientific and cultural tradition in the field of immunity and in the field of immunization, which led to the leadership of immunization given by the Global Health Security Agenda. We are ready to play this role and take this responsibility. We, as regulators, feel the responsibility of assuring high quality and quantity of vaccines, with safety and security as our primary goal, of performing the best vaccine vigilance actions, of offering the best possible communication tools, and of promoting vaccination as one of the most important actions for a sustainable health system. We have constructed this conference in a way that what has to be said about vaccinations is recognized. And we do hope, by the end of the day, to reach a global consensus about immunization that could serve as a support for Minister Lorenzini's proposals at the EU Council early in December.